Today we are going to continue with the second age-based rule. Previously we have looked at the first age-based rule, that is the Young's rule. We have looked at the Young's rule. If you have not gone through that part of the video, I would advise you quickly go through it. Still on this same page, and we have discussed it exhaustively, and example was also given. So today we'll continue with the second age-based rule. If you can remember, for those who have watched it, we made mention that the age-based rules are three out of the 6 rules that we are going to be considering in this video. The first age-based rule is the Young's rule. Then the second one is the Dilling'S rule. Then the third rule is the Friedman'S rule. So these are the 3 rules that are age-based, meaning they have connection with age, especially either in years for Young's rule and the Dilling'S rule. They are age-based rules based on the year or years of the child, while the Friedman'S rule is considering age of the child in months. So these are the 3 age-based rules. Though we have some schools of thought who that are against the age-based rules based on some factors that are not put into consideration. So as regards that, they are really saying that they are not too accurate as compared to when you consider the weight of the child. But notwithstanding, it seems to be also very effective whenever they are utilized to calculate the dose of a drug. So we'll quickly dive into the second rule, which is the Dilling'S rule. So the Dilling'S rule is where we are going to kickstart today's class, and this rule is very, very similar to the Young's rule with regards to their relationship in terms of the formula and some parameters. I think only one parameter differentiated the Young's rule from the Dilling'S rule. So now, if you can remember, in the Young's rule, we said the formula is the dose of a drug. If you want to calculate or get the dose of a drug to be administered to a child, is simply the, let's say, dose is what? Age of child in what? In year or years, as the case may be, multiplied by the adult dose over same age of child in what? Years as well, or year as the case may be, plus 12. So this is the Young's rule. Now, the major difference, or the area we have difference with the Dilling'S rule is with regards to the denominator. That is the denominator, where in Young's rule we have age of child in years plus 12, but for Dilling'S rule this denominator is not the same, but what we have as the numerator is the same for Dilling'S rule as well. So let's quickly take down the Dilling'S rule, or the formula that we can use to calculate dose based on Dilling'S rule. Now, this is the formula: that dose of a drug to administered or to be administered to a child is given to the age of that child. That is age of child. Of course, in year or years. If the child is 1 year, then it stays as year. If the child is more than 1, of course, it becomes years. Age of child in years multiplied by the adult dose over 20. So this is the formula for calculating drug dose using the Dilling'S rule. Now, if you look at this formula, the only difference we have is with this denominator, that is this 20. But any other parameter is the same with that of the Young's rule. So this is just the difference. So and one of the reasons why we call it age-based rule is because you can see the age of child is going to be in years, going to be in years. Now, one very important similarity that is common with every rule that we're going to be coming across as far as this lecture series is concerned is the adult dose. Now, adult dose seems to appear in all of the rules. So far, we have seen in the young rule that the adult dose surfaced there, and now again we're having adult dose in the Dilling'S rule. Likewise, in some other rules that we're going to be coming across, you will still find adult dose. That's to say, before you can calculate the dose of a drug that you're going to administer to a child, it's very, very essential that you know the adult dose of that particular drug. Without knowing the adult dose, it will be difficult for you to get the child's dose. So please take note of that. And quickly, let's take at least an example for us to have a better understanding of the concept. Now, I'll take this example directly from the reference material we are using. That is the calculations in pharmacology for nurses. For those who have seen the first video, I've already explained the source of this book. So let's take this example directly. It's on page 13 of this book. Now, quickly, what dose of paracetamol injection will you administer to a child of 10 years if the adult dose is 600 milligrams? Now, this is a typical example on how to calculate dose of a drug for a pediatric or for a child. Now, this is scenario. Let's take the information down. Now, the information here that we're giving first is the age of the child has been given to us to be what? To be 10. So we have age of child to be 10. The age of child is 10. That is 10 years. So that is to say this child, I want to calculate his dose. That is for the drug paracetamol. Is 10 years. Then the adult dose has also been given to us to be 600 milligrams. So this is the two most important parameters that we have extracted from the question, and of course this is the only information that we need considering the formula. Now this is very, very easy. It's very, very easy in the sense that we have the child's age, which is the first part of the formula. Then we also have the adult dose, which is also here at 600 milligrams. Then of course we have the denominator, which is 20. So this is the question is set. Now, this is more or less a real life situation. Let's assume I have a patient in my house or in the hospital or in the facility, and this patient is running temperature, maybe fever of around 40 or 38 degrees, and I want to bring down this temperature, for instance. And I've taken all the necessary history of how and when it started and all of the other information that I will need. But one very important parameter I will need to ask the parents or the guardian or whosoever brought the child is what is the age of the child, which is very essential to calculating the dose. Then, of course, the other information, I already have them. The aspect of dose, I have it already. I don't need to consult or ask anybody because I know for an adult, paracetamol injection is usually 600 milligram, and that is only information I will need. So quickly, let us utilize this information um, to calculate the dose of this injection, that is paracetamol injection, we are going to administer or give to a child of 10 years. So now, age of child has been given to be 10. We already have information on the adult dose, which is 600 milligram, 600 milligrams. Then our denominator, which is 20. So if you compute this, 10 times 600 will give you 6,000. Then the denominator still remains 20. So at the end of it all, you have that 6,000 by 20 will give us 300. Of course, 300 milligrams. So for a child of 10 years, based on this information available to us, the child will be administered with 300 milligrams of paracetamol injection. So this is basically how to go about the Dilling'S rule. I believe it's so simple, but if you want to lay your hands more on practice question, in this book you can have access to it. If you are interested, we can also make it available to you. And we have a section where we have the practice question, where you can practice some of these questions. We have a lot of questions with regards to all of these rules, but it's not more than this. It's not more than this. The only thing you will need whenever you want to use the Dilling's rule to calculate the dose of a child that will be administered to a child is using this formula. Once you have the age of the child and you already know the adult dose of that very drug, then of course you are good to go. So this is how to calculate drug dose based on Dilling's rule. So the next rule we are going to be considering is the Friedman's's rule. But in Friedman's's rule, the consideration in this case is not the age of child in years, is age of child in months. So let's quickly dive into the third age-based rule, which is going to be the last for the age-based rules. So the third age-based rule is the Friedman's rule. Is the Friedman's rule. The Friedman's is the Friedman's rule. So this is the third and the last age-based rule. Now, this Friedman's rule is still telling us on how, or guiding us or informing us on how to calculate the dose of a drug that should be administered to still pediatric. These rules are not applicable to adults. They are simply applicable to children. So you want to know the dose that should be administered to a child, whether it's an injection, is whatever. You can use these particular rules, depending or of course is dependent on you knowing the adult dose first, all of them. So now, the Friedman's rule is a rule that takes into account the age of the child in months. So that means the age range must be in months. So the child should be or can be from 1 month up to 11 months. So the child age can be from 1 month up to 11 months. So that is when you can apply this. So if a child is less than 1 month, that means the Friedman's rule is not applicable. Likewise, if the age of the child is greater than 11, mostly from 12 months, which of course we have clocked or entered a year old, so that means this rule is also not applicable. Once the child is greater than 11, going into 12 or is 12, of course, you are going to consider another age-based rule, that is the Young's rule. So for this particular rule, the consideration is a month, and the age of the child must be from 1 month up to 11 months. So now, what does the rule says? The rule says age of child still, age of child, but this time around age is in months. Age of child in months. Let's put months. Okay, month or months, as the case may be. The child can still be 1 month like that. So age of child in months multiplied by the adult dose. Let me write it clearly so that I think the space is a bit. Let me reduce the space from here. So the dose is given to be age of child. Age of child in months or months in months multiplied by the adult dose. This time around, denominator is given to be 150. So this is the Friedman's rule. So this is simply the Friedman's. Now, it has some differences with the other rules that we have stated. But of course, like other rules, we have some similarities or similarity as well. Now, the first differences with the two other rules that we have stated is this time around the age of the child is in months, and not in years. And the denominator here has changed from 20 that we used for the Dilling'S rule to what? To 150. But of course, one thing remains constant, which is the adult dose. So the adult dose remains constant for all the three age-based rules that we have considered or we have looked or we have calculated the dose of a drug for a child, right? So this is more or less a constant parameter. So this is just the formula or what the rule says. So your Friedman'S rule is telling us the age of the child is in months, so you multiply by the adult dose over 150. So quickly, let's take at least an example to um, expatiate on its application. Now let's take from the reference material still quickly. How many milligram of aspirin tablet? How many milligram of aspirin tablet will you give to a child of 10 months if the adult dose is 600? If the adult dose is 600. So this is a typical example for a child, for instance, that is still having issues with probably temperature and another condition that we can use aspirin for. And this time I want to know the dose that you give, just the amount of the drug you are going to give. Now, let's quickly take down our information. Now, from the information we have obtained from this question, the first information is the age of child. Now, age of child has been given to us. Age of the child has been given to us, but this time around, age is what is in months, and we have 10 months as the age of the child. Then the second important information here again is the adult dose of aspirin was given to be 600. So the adult dose is still 600. So what are we looking for? We are looking for dose. So what dose of aspirin will you give to a child of 10 months, considering that the adult dose is 600 milligrams? So quickly, we have obtained, or we have our basic information that we require for this calculation. Let's quickly dive into application. Now, we know age of child in months is 10 months, right? Then the adult dose still is given to be 600 milligrams over 150. So this is, we have substituted the information into the formula. Now, let's continue. 10 multiplied by 600 will give us 6,000 over 150. So this is the substitution. Now, this will give us 40 milligrams. So finally, the dose of aspirin tablet, or aspirin rather, we were not told whether it's tablet or just that aspect is silent. So let's assume we don't even know the form of the drug. Now, so if we have inputted the information, you arrive at 40 as the dose to be administered through that charge. So this is basically how to apply this rule. So these rules are not difficult. The only information you need to know is, first, you know the age of the child. In this case, considering months, you know the age of the child and months. And if you are considering the other age-based rules, then the age should be considered in years or year. Then, of course, a very important parameter that remains constant all through the three age-based rules is the adult dose. So this is briefly how to calculate drug dose for pediatrics or children using the age-based rules. Now, though we have some discrepancies or issues or acceptability of these age-based rules with some schools of thought or with some scholars or with some healthcare practitioners. And one of the major aspects where we have this discrepancy or discrepancies, as the case may be, is with regards to its accuracy or the accuracy of the age-based rules. Now, one of the issue of contention is, if, for instance, I have two children that are of the same age, but unfortunately, one of the child is very, is very slim. Let me use that word, looking very slim or light, and the other one is looking floppy, bigger in terms of its size. and both of them are of the same age, maybe 5 years. And this one is, the one is looking more of a 5-year-old child, then the second one is looking more of a 10 or even a 15-year-old child based on his body makeup. Now, two things are involved. First thing, why people are actually not in support most times with regards to its accuracy is because of these reasons. Now, for a child that is looking very slight, very light, there is the possibility of giving an overdose. It's very possible because the dose might be so big for so huge or so large for the child because of its body composition or body makeup, right? So that means there might be some evidences or some possibilities of drug overdose in such children. Likewise, in the case of a child that is looking floppy or that is heavyweight, the muscles are very huge, very big. The organs, every other part is also very big as well. So if you're not careful, you might give a drug that is underdosed that might produce subtherapeutic effect. So meaning at the end of it all, the effect of the drug might not produce any pharmacological action or effect with regards to what you want to manage. So that is why a lot of people who are actually against this age-based rules, although they seems to be very, very effective when they are used, but because of this fear of using the age of children, right, especially with those ones that are lightweight and of course the heavyweight of children, you might find out that there might be some discrepancies in terms of the drug absorption, drug distribution, and all of that. The other one that is very floppy will require a larger dose in most cases, right, to be able to meet up with his body demand with regards to the increase in size and all of that. While the other one that has a smaller body or lightweight might result in toxicity because of its own. So that is why sometimes there is that argument with regards to its accuracy. But notwithstanding, this can be resolved by using the weight-based rules. So in the next session, we are going to consider the dose of a drug or how you can calculate the dose of a drug using the weight of the child. Of course, in this regard, everybody will be given what is rightfully his, right? So that means if you are 10 kg or 10 pounds, you will get a drug or a dose that is equivalent to your weight. So if the other one is 15 pounds or 15 kg, he or she will also get a dose that is that befits his weight or her weight. So next, we're going to dive into the weight-based rules shortly.